Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Benign versus the malignant breast lump and the USG findings. Now when you look at the benign lump, so benign lump, it is hyperechoic. It is hyperechoic, and there is also a presence of an oval and well circumscribed lump. So it is oval and it is well circumscribed lump, and there's a thin echogenic pseudocapsule. It is a thin echogenic pseudocapsule. This pseudocapsule, and there's a peripheral vascularity. So peripheral vascularity is present in the benign lump. So there's a peripheral vascularity. So this is present in the benign lump. Then moving on, how is it different from the malignant lump? So in terms of the malignant lump, it is hypoechogenic. Benign was hyper. This is going to be hypoechogenic, and here the lump will be taller and wider. So it is lump being taller. So lump is tall plus it is wider. So you can write it as wide. Then it is ill-defined. So it is ill-defined echogenic halo. So malignant will be ill-defined echogenic halo. So the central vascularity is present, whereas in benign it was a peripheral vascularity. In malignant it is going to be the central vascularity. So the most sensitive and the most common findings of the malignancy on the USG is, so what is the most? So there are some important pointers. The most sensitive and the most common finding of the malignancy. So what is the answer? The answer is the presence of the lump. It will be taller and wider. So the lump being taller as well as it is wider. Next is, let's look at the most specific findings of the malignancy of the USG. So the most specific finding of the malignancy, and this is on the USG. So the most specific finding of malignancy of the USG is going to be the central vascularity. It is nothing but the presence of the central vascularity. To learn and grow daily like this, please do subscribe.